Developmental surveillance has six components. First, eliciting and attending to the parents' concerns about their child's development. By asking about parents' concerns, the pediatric healthcare professional can elicit important information about the child's development, learning, or behavior. A parent also may bring the result of screening or evaluation by an outside professional to the pediatrician's attention, particularly if concerns are noted. In such instances, the pediatric healthcare professional should seek information on the test performed and its results for review and discussion with the family. Direct discussion with the outside professional about these concerns also may be beneficial. Discussions with the family or outside professional should be documented in the medical record. The absence of parental or professional concern does not preclude the possibility of serious developmental delays. Second, obtaining, documenting, and maintaining a developmental history. A developmental history is a vital component of any history taken during a health supervision visit. By asking questions about changes parents have seen in their child's development since the last visit or observing age-specific developmental skill attainment, such as whether the child is walking or pointing. The pediatric healthcare professional may identify delays or abnormalities in child's development that warrant further investigation. Developmental milestones and red flag resources are available to engage families and other professionals as collaborative partners in surveillance. Third, making accurate and informed observation of the child. As trained and experienced professionals, pediatricians and other pediatric healthcare professionals have the expertise and comparative knowledge to identify developmental concerns. A careful physical and developmental examination within the context of the health supervision visit is integral to the development surveillance. Limited evidence suggests observation of the parent-child interaction also may aid in identifying children with delayed development. Fourth, identifying risks and strengths and protective factors. A risk assessment is an important part of developmental surveillance. Environmental, genetic, biological, social, and demographic factors can increase a child's risk for delays in development. Multiple risk factors can amplify each other. Children with established risk factors may be referred directly for developmental evaluation and early intervention services or may require developmental surveillance at more frequent intervals than children with risk factors. Some medical conditions can increase a child's risk for developmental delays. These conditions include perinatal complications, congenital and other neurologic conditions, complex congenital heart disease, genetic conditions, and other chronic conditions. Fifth, maintaining an accurate record of the process and findings. Medical records should document the outcome of all surveillance and screening activities during preventive care visits. Additionally, specific actions taken or planned, such as scheduling an early follow-up visit, scheduling a visit to discuss developmental concerns more fully, or referrals to medical specialists or early childhood programs and specialists, also should be noted as part of developmental surveillance and screening. A record might contain a table in which the date of administration and the results of developmental surveillance and formal screens are recorded in relationship to the child's age. If electronic health records are used, developmental findings and plans can be recorded with automatic prompts created for further action. 6. Sharing and obtaining opinions and findings with other professionals. Although developmental surveillance is performed in the pediatric medical home, the opinions and findings obtained by the pediatric healthcare professionals about the child's development have importance beyond this setting. In particular, a wide range of professionals may be engaged with the young and developing child and will benefit from conclusions reached by the pediatric healthcare professionals' regular ongoing developmental surveillance. These include child care providers, home visitors, preschool teachers, and developmental therapists. At the same time, some also are likely making observations of their own the child's development and may be performing their own developmental screening. Early intervention therapies also may be actively engaged with the child for both evaluation and treatment of developmental concerns. Consistent with the team-based approach, coordination of care with two-way communication between the patient and family-centered medical home and entities outside the medical home needs to be systematic and consistent. Any entity outside the medical home that provides screening should have a systematic approach to communication of screen results, both positive and negative, to the medical home. Communication between a member of medical home staff and these professionals on the child's development is therefore a critical part of the surveillance to ensure optimal care and coordination of efforts and activities to optimize the child's development. When, when screening or evaluation is performed by another professional, these results must be shared and discussed with the parent and pediatric healthcare professional, including the tests performed and results obtained. Direct communication between the pediatric healthcare professional and the other professional may be helpful. It should be noted that such communication, particularly electronic communication, is subject to Health Insurance Portability and Accountability Act of 1996 security requirements and must be protected.